Ever wondered how to answer the classic interview question? Describe a time when you went above and beyond for a patient? Well, you're in the right place. Welcome to the Victory Education Lounge, your go-to hub for mastering medical residency interviews. Today, we're focusing on a question that's not just common, but can be a real game changer in your interview. We're here to help you understand what interviewers are really asking, how to strategize your response, and even provide some sample answers to spark your thinking. And remember, we'd love to hear from you, so don't forget to hit that like button, subscribe for more invaluable insights, and drop a comment below to join the conversation. Ready to turn that question mark into an exclamation point? Dive in to dissect this question and strategize your winning answer. First, let's dissect this question. Describe a time when you went above and beyond for a patient. It may seem straightforward, but there's a lot more beneath the surface. When interviewers pose this question, they're looking to evaluate a number of key attributes that make a standout resident. This question is designed to assess your dedication, empathy, and problem-solving skills. It's not just about the action you took, but why it was considered above and beyond the standard care. It's about the impact you had on the patient, and how this reflects on your character and suitability for residency. But why are these elements so important? Well, empathy allows you to understand and address the needs of your patients. It's the cornerstone of good patient care. Dedication, on the other hand, shows your willingness to go the extra mile, to put in the hard yards to ensure the best possible outcome for your patients. Problem-solving skills are crucial in a medical setting. No two patients are the same, and no two situations are identical. Being able to think on your feet and come up with creative solutions to challenges is a vital skill for any resident. So when you're asked to describe a time when you went above and beyond for a patient, it's your chance to showcase these qualities. It's about demonstrating your initiative, your compassion, and your ability to rise to the occasion for the sake of patient care. Your answer should be a narrative, a story that illustrates your commitment to your patients. It should highlight a situation where you went beyond the call of duty, took a proactive approach, and made a significant positive impact. In essence, your answer should showcase your initiative, compassion, and commitment to patient care. It's not just about what you did, but why you did it, how you did it, and the difference it made. So as you prepare for your residency interviews, think about those moments when you truly went above and beyond for a patient. Those are the stories that will help you shine. Scene script. Interviewers are looking for key traits that prove your suitability for residency. Let's break down what they're after. First, empathy. This goes beyond just understanding what the patient might be feeling. It's about actively addressing those needs, making sure the patient feels heard, and their concerns are taken seriously. So when you're sharing your story, emphasize how you identified and responded to the patient's emotional needs. Next up is initiative. Interviewers want to see that you're not just waiting for instructions, you're proactive. You're taking steps to improve patient care without being prompted. This shows your commitment and dedication. So highlight moments where you took the lead in addressing a patient's needs or improving their situation. Thirdly, problem-solving skills. Medicine is unpredictable and every day brings new challenges. How do you handle these curveballs? Show that you can think on your feet, that you're creative and adaptable, finding solutions even when the path isn't clear. Then, we have communication. Being a great doctor isn't just about medical knowledge, it's about effectively interacting with patients, their families, and your team members. Your story should illustrate your ability to communicate clearly and effectively, fostering trust and collaboration. Lastly, professionalism and ethical judgment. Balancing patient care with ethical and professional standards is paramount. This could mean respecting patient privacy, maintaining boundaries, or making difficult decisions in the best interest of the patient. Highlight moments where you upheld these standards even in challenging situations. In summary, your answer should be a narrative that reflects these qualities. It's not just about telling what happened, but illustrating how you embody these traits through your actions. So think about your experiences, select a story that truly showcases these aspects, and remember to frame it in a way that clearly highlights your empathy, initiative, problem-solving skills, communication, and ethical judgment. Your answer must reflect these qualities. It's not just the situation itself, but how you handled it, the thought process behind your actions, and the outcome that truly matters to the interviewers. So choose wisely and present your story effectively. When crafting your answer, ensure it has a clear structure. Here's a handy model to follow. Situation, action, outcome. Start by detailing the situation you found yourself in, and be sure to highlight any unique challenges it presented. Next, describe the action you took. This is where you can really show your initiative and problem-solving skills. Make it clear what you did that went beyond the usual expectations. Lastly, discuss the outcome. How did your actions affect the patient and possibly your team? Were there any long-term implications? This is your opportunity to demonstrate the impact of your dedication and empathy. Remember to underscore your thought process throughout, as this gives the interviewer insight into how you approach complex situations. It's not just about what you did, but why you did it, and how you knew it was the right thing to do. Now let's look at some sample answers. Let's delve into some potential responses to this question. Our first scenario, let's call it proactive care. Suppose you were caring for a patient scheduled for a complex surgical procedure. The patient was noticeably anxious, and though it wasn't required, you took the initiative to spend extra time with them. You explained the procedure in simple terms, answered their questions, and reassured them. On the day of the surgery, the patient was noticeably calmer. Their family later expressed gratitude for your compassion and initiative. This story highlights your empathy and proactive approach. Next, we have creative problem solving. Picture this. You're working in a rural clinic and you're faced with a severe shortage of a particular medication. Instead of accepting defeat, you liaise with a nearby hospital and arrange a temporary exchange of supplies. Your quick thinking and resourcefulness ensured uninterrupted patient care. This scenario showcases your problem-solving skills and adaptability. Moving on to interdisciplinary collaboration. Let's say a patient under your care wasn't responding to a treatment plan. You noticed this and brought it up in a team meeting. Together with the team, you brainstormed alternative strategies, integrating suggestions from different specialties. The revised plan worked, and the patient started improving. This story underscores your communication skills, teamwork, and patient-centric approach. Fourth on our list is ethical dilemma. Perhaps you were placed in a situation where a patient's family requested a treatment that was not in the best interest of the patient. Despite the emotional pressure, you advocated for the patient, explaining the risks to the family and suggesting a more suitable treatment. Your actions upheld medical ethics and demonstrated your professionalism. Lastly, we have personal touch. Imagine you had a long-term patient who was feeling low because they were going to spend their birthday in the hospital. You coordinated with the staff to surprise the patient with a small celebration. This gesture uplifted the patient's spirit and improved their overall outlook. By going beyond your medical duties, you displayed personal care and compassion. Each of these scenarios illustrates a different characteristic that residency programs value. However, it's crucial to remember that these are just examples. Your own experiences, no matter how big or small they may seem, can be just as impactful. The key is not what the situation is, but how you navigated it. It's about your thought process, your actions, and their impact. Also, remember to practice your responses. Not to memorize them word for word, but to get comfortable telling your stories. You want to come across as authentic, confident, and articulate during your interview. And finally, be patient with yourself. It's okay if you don't have a perfect answer right away. Reflect on your experiences. You might be surprised at how many times you've gone above and beyond for a patient. Remember, the key is to choose a story that genuinely reflects your experiences and values. In conclusion, authenticity is key. It's essential to remember that your personal stories should not only be factual, but they should also resonate with your experiences and values. This is what will set you apart from other applicants and make your responses memorable. To quickly recap, we've dissected the question, describe a time when you went above and beyond for a patient, and highlighted what interviewers look for in your response. They want to see evidence of your empathy, initiative, problem-solving skills, communication abilities, and professionalism. We also discussed how to strategically structure your answer. Start with a clear situation, then delve into the action you took, and finally, explain the outcome. Throughout your response, make sure to highlight your thought process and the impact of your actions, not only on your patient but also on your team. We've provided you with 5 sample answers to give you a sense of how to craft your response. Each example illustrates a different facet of going above and beyond for a patient. From proactive care and creative problem-solving to interdisciplinary collaboration, ethical dilemmas, and adding a personal touch. Remember, the goal is not to memorize these examples, but to use them as inspiration to help you reflect on your own experiences and identify the moments where you've truly gone the extra mile for a patient. So, take some time, reflect on your experiences, and prepare your answers. And don't hesitate to revisit this video or any of our other resources if you need a refresher. If you found this video helpful, please give it a thumbs up, subscribe to our channel and drop a comment below if you have any questions or if there's a specific topic you'd like us to cover in future videos. We're here to support you on your journey to a successful medical residency. Good luck with your interviews and see you in the next video.